Welcome, and thank you for joining us for our tour of MedStar Georgetown University Hospital's Stem Cell Transplant and Immunotherapy Program, Blood and Marrow Collection Program, and Cell Therapy Manufacturing Facility. Our first stop is the Blood and Marrow Collection Program offices. Right here we have our waiting area, which is comfortable for our donors. And as we make our way to the exam room, you can see we have a hand sanitizer station and a hand washing sink available. Inside the exam room, we have another hand washing sink and appropriate waste disposal. Here we have our scale with its preventative maintenance sticker. And here's our vital signs machine and sharps container. And you can see the appropriate PPE for the room. Over here you can see another sharps container and PPE for the phlebotomy area. And as we make our way across the phlebotomy area, we can see where we keep our locked storage of phlebotomy materials and PPE. At the top right is our hygrometer used for daily tracking of temperature and humidity. As we continue through the BMCP, back here we have cabinetry for our patient charts, which is kept locked. Here you can see Sam pointing out our downtime labels and unassigned DINs, as well as our obsolete DINs. These are segregated from our active unassigned DINs and are marked not to be used. Here we have our competencies, temp and humidity logs, quality management plan, and SOP binders. And over here we have our safety manual. As we make our way out of the office, you can see our fire safety plan. And here we have our code carts in the hallway with their expiration dates. We also have available oxygen. And here is the closest fire extinguisher. Across the hall is our shared QC room and labeling office. This is shared by the BMCP and CTMF. This room requires badge access for entry. Here we have a hand washing sink as well as our binders for tracking. And you can see our computer and space for labeling of products after they've been collected. And above that is the printer for our print-on-demand labels. Waste disposal can be seen here. And up and to the left you can see our temperature and humidity probe as well as a camera. Here's our cooler cleaning log and a primed cooler that has ice packs as well as a circular of information. These coolers are of course validated. And this is the freezer where we keep our ice packs for storage. As we continue in the QC room, we have some benches for separation of our products. We have bench number 1 and bench number 2. These are our supplies that we utilize for sampling our NMDP products. And a printer and shelves for our validation materials we use for current validations. This is our biosafety cabinet. Our BSCs are certified, and here's our most recent certification. This is our incubator. We currently don't use it for any clinical cases. It is used for islet and labeled for most recent preventative maintenance. This is one of our storage rooms located in the same hallway. Supplies that are in quarantine are kept on the bottom shelf here until they're released. All other supplies in this room are good for use. And of course, these supplies are kept in a room that is monitored for temperature and humidity. Here's another storage area in the same hallway. This is another shared space with BMCP. It's also monitored for temperature and humidity. Both of the storage areas are secured with a keypad. And as we head into our islet cell lab, you can see it's secured with badge access. This is our storage room, and these are the CO2 tanks that feed our incubator. And here is its most recent service. This is our pass-through and some supplies. Here's our hand washing sink to wash into the clean room. And this is our clean room certification. Of course, we have PPE available, we use 2 validated coolers. This is our negative 80-degree freezer, which receives preventative maintenance and validation annually. And next to that is our storage room refrigerator. All released reagents that are used in the clean room are kept in this refrigerator prior to entry into the clean room. It also receives preventative maintenance annually. This is a lighthouse probe used for temperature and humidity monitoring. And we have a second hygrometer for tracking. Our clean room requires badge access in order to gown up to enter it. This is our clean room and the various pieces of equipment that'll be used in it for different processes. They are all validated and up to date. They are stickered to reflect that. Our clean room has 4 BSCs, which all receive preventative maintenance and certification annually. This is another temperature and humidity probe, as well as an alarm and warning system for the clean room. Here we have our centrifuge, which also receives preventative maintenance and is certified. And we have a Kobe machine, Kobe 2991, used for islet cell processing. Here's our refrigerator that we have in the clean room for holding reagents that are being used for clean room processing. This is our second centrifuge, which is a benchtop. It is also certified. The clean room is a one-way flow, and we are heading into the degown room, where staff go to degown and exit. Next is room M1345 of our cell therapy manufacturing facility. This space requires keypad entry. This is our analytical equipment, our cell counter receiving preventative maintenance twice a year. Here you can see our 2 fax calibers, which also receive semi-annual preventative maintenance. We have clear separation between our processing analytical areas. This is our weigh station where we weigh products. And we have bench 1 and bench 2. And here are the supplies we use while in this room. Here you can see our labeling station, which has our labeling computer and labeling printers. This is our monitored refrigerator used for storing processing reagents and products. It also receives preventative maintenance annually. It's monitored by Datatron systems, and we use these boxes to separate products if we have more than one. Here's our certified floor centrifuge. Next, we'll be heading to the cryopreservation room. This room is also keypad secured. We have 5 freezers, flammable cabinet, and cabinetry for charts, and here we have dry shippers. We also have a scale for weighing our dry shippers before and after charging. We have a monitored negative 20-degree freezer used for storing ice blankets for process. Our liquid nitrogen freezers receive preventative maintenance annually. And here's the oxygen sensor for the room. We have a cryomed control rate freezer. And this room is also monitored by Datatron. Our water baths for thawing product are stored in this room. These also receive preventative maintenance annually. Here we have our walk-in refrigerator that we share with the blood bank. This shelf contains ready-to-use supplies, and the bottom shelf contains supplies that are quarantined. They'll stay on this shelf until they're released for use, and then they'll be relocated. The cath lab is where our Marrow procedures are performed. It's located on the 4th floor of the main building. This is the pre-procedure holding area, room M1404. This room has 3 bays where patients are prepared for procedures. These bays are outfitted with privacy curtains, hand sanitizer stations, and sharps containers. Here you can see a blanket warmer and a hand washing station. Behind the window is the nurse's desk, medication pyxis, and medication disposal bin. Next to the daily inspected code cart is a red disposal bin. And over by our door are gloves, a sharps container, and wastebasket. As you exit, take advantage of the hand sanitizer station. As we enter the procedural room, you see a table prepped for bone marrow harvest, with plenty of cushioning for ensuring the safety of our donors during collection. A medication card is available for our anesthesia team, and behind the anesthesia machine, a temperature and humidity monitor is checked daily throughout the week prior to the first procedure. Next to the hand washing sink, the countertop is used for documentation throughout the procedure and final labeling of the product. We have a red waste disposal and a non-hazardous disposal next to our code cart, which is also checked daily. And here you can see the temp and humidity, procedure room cleaning, and materials and supplies logs. And our last stop in the cath lab is our scrub room. Seen is the sink used by physicians, nurse practitioners, and techs as they prepare prior to doing a bone marrow harvest. Now we'll head to the second floor of our main building to go to our apheresis unit. In room M2418, we have 3 bays for apheresis. The room is outfitted with sharps, red, and medication disposal containers, as well as plenty of space for our reagents and supplies, where we use the first in, first out system. Our standing scale is checked annually. We keep a log of our temperature and humidity monitoring, which is done by Datatron via the probe seen here. We also track the cleaning of the unit in this logbook. The unit is made up of 3 bays with privacy curtains between each bed. When conducting apheresis collections, we make use of the blood warmers, which are maintained annually. The Optia machines also receive preventative maintenance. We keep a QC log of our Optia machines and blood warmers. The unit is outfitted with signage explaining the possible necessity for a team member to accompany patients into the restroom. The restroom has adequate space and lighting for safe maneuvering. Just outside the restroom, we have a red waste container and our dirty utility room. Down the hall in a keypad secured room is the storage area for some of the apheresis critical supplies. This storage area has a yellow quarantine space so that products can be quarantined prior to their being put into circulation. Here we have critical supply receipt paperwork. In the next room, we have more storage. The supplies here are controlled with a first in, first out system, indicated on the shelves. In this yellow area, we quarantine products prior to circulation. We also log them in the critical supply logbook. This area is temperature and humidity monitored via this Datatron probe. As we continue on the second floor, we'll be heading to our inpatient designated stem cell transplant unit, known as Tube Less. As we arrive, we go through an airlocked door which maintains positive pressure on the unit. There's posted information about evacuation and fire pull stations. You see the secretary's desk where there is signage about visitation and safety for visitors. Behind the desk is the BMT downtime policy manual, as well as cleaning logs for environmental services. Two blesses all private rooms, which allow for privacy and adequate care of immunocompromised patients. We also have the ability to care for patients on various isolation with the appropriate PPE. Here's the supply pyxis where we keep patient care supplies, as well as personal protective equipment for our staff safety. In this hallway, you'll also notice our defibrillator, which is maintained by our biomedical engineering department. Here's our code cart, which is checked daily. As we enter a patient room, you can see signage indicating neutropenic precautions. We have adequate PPE, waste disposal receptacles, including sharps and chemotherapy disposals. We have lift equipment to ensure safe patient handling. All our infusion pumps receive preventative maintenance, as you can see. We have patient fall alarms in all our patient rooms, and setups for oxygen and suction. We have signage to remind patients that we should stay with them to prevent falls. And in our bathrooms, we have pull cords and rails for patient safety and mobility. As we exit the bathroom, you can see a hand sanitizer station, red bags for easily accessible waste disposal, and a whiteboard for communication. This is our medication room, that is keypad entry. This is a no interruption zone so that staff can concentrate on their medications. The provider station is easily accessible, and you can see we have the ability to care for patients on continuous cardiac monitoring. This is our nutrition room and our clean supply room, where extra PPE as well as patient care items are stored. And we have monitors to ensure that positive pressure is maintained throughout the unit. As we head out of 2-bless, we're going to continue on the second floor, but head back to the main building to go to our bone marrow and stem cell transplant clinic. Patients can come to this clinic to see nurse practitioners and physicians. We have a small waiting area which allows for the separation of patients, and we have a financial counseling office. As we enter one of our clinical rooms, you can see we have sharps disposal, PPE available, and plenty of lighting and appropriate space for patient mobility. Here you can see a hand washing sink and non-hazardous waste container. Computers in each room allow for nurses and physicians to chart as they work with their patients, and thermostats allow for patient comfort to be maintained. In the main work area of our clinical and nursing staff, you can see our medication pyxis and refrigerator. The temperature is monitored by our pharmacy. Down low you can see another medication refrigerator, and up to the right of that, a hand washing sink. This is our standing scale, which is maintained by biomedical engineering annually. And this is our infusion area. Currently, our infusions have been relocated to another area of the hospital. We maintain an eye wash station in the clinical area as seen here. There's also a hand washing sink and a sharps container. Our code card is easily accessible in the main hallway. We'll continue into the office areas of our clinic. Here is our conference room, not just used for meetings, but also for hosting our caregiver classes. Fire extinguishers are accessible and visible, as are fire pull stations and our evacuation plan. Patient information is maintained behind locked doors and locked cabinets. These are kept in the data room, as well as in the nursing office. The nursing office houses support staff, as well as our clinical nurse coordinators. As we head into the patient restroom, we can see there's adequate lighting and space for patient safety and mobility. A A bit further down the hall is a nourishment station. Here is our equipment storage room behind the keypad locked door. This is where we keep our clean supplies and equipment. Here is our Hoyer lift, EKG, and portable oxygen. As we return to the entrance of the clinic, you can again see the nourishment station and our front desk. We'll continue on to tour some of the departments with which we coordinate to provide a comprehensive and safe patient experience. Our emergency department entrance can be found on Reservoir Road. We have adequate signage regarding our visitor restrictions and requirements due to COVID. This is an example of the medical alert card given to our patients. They're instructed to present this if they ever need to go to an emergency department to ensure they receive medical care appropriate to their special needs. After checking in at the front desk, our stem cell transplant and cellular therapy patients are taken to an isolation room to maintain their safety. From here, they can be triaged and appropriately cared for. Our goal, if they're to be admitted, is to transfer them to the BMT unit or the ICU as quickly as possible. C41 is one of our ICUs located on the 4th floor of the CCC building. Our ICUs have the appropriate PPE for various isolations, including neutropenic precautions. They're equipped with GEM machines, allowing for rapid assessment of labs. They have daily checked code carts and defibrillators, and allow for continuous cardiac monitoring. The unit's medication Pyxis provides controlled accessibility to frequently needed medication for critical care patients, and separate, appropriate, clean, and dirty utility rooms prevent contamination and the spread of infection. If a BMT patient is transferred or admitted to our surgical ICU, a HEPA filter is placed in the room to assure a positive pressure environment. We have a main pharmacy on the ground floor of the Bless building, as well as satellite pharmacies in the hospital. On the 5th floor of the main building is 5 North, our infusion clinic. Our newly renovated waiting area allows for comfortable social distancing of our patients. As we enter, to our left is the patient bathroom. There is adequate lighting and space for mobility and safety. In the same hallway is our medication room, which is another no interruption zone. A hand washing sink and eye wash station are located in this room. There are also a sharps container and a medication disposal bin. Our infusion bays have curtains to provide privacy. There are multiple waste receptacles for saturated materials and chemotherapy disposal. The unit is also equipped with hand washing stations throughout. The equipment storage room is behind a keypad locked door. Our code cart is checked daily and is easily accessible in the main hallway, as is our standing scale, which is maintained by our biomedical engineering department annually. Our last stop on the tour is our new 5 East Infusion Clinic, which just opened this past week. With 28 spacious private rooms outfitted with adjustable lighting, it's clear our patients' experience is our top priority. Providers have ample workspace and access to computers. Each patient room has hand sanitizer inside, and sinks are accessible throughout the clinic. Bathrooms have plenty of space and lighting for safety and mobility, and emergency equipment is available throughout the unit. We are proud of this newest addition to MedStar Georgetown University Hospital, as well as the rest of the units in our program, and we're happy to get to share them with you today. Thank you for joining us.